Welcome back to Face the Nation. We continue our conversation with Michigan Democratic Governor Gretchen Whitmer. Governor, you have publicly called for a surge of vaccine doses to your state, but the White House's COVID response coordinator, Jeff Zients, as we played at the top of the show, shut that down. Does this offer that they're giving you of vaccinators, of resources, make up for the fact that they're not surging you doses?
Let me start by saying this. We did not have a national strategy for a long period of time. And then the Biden White House came in and we have one. And by and large, it's working and they're doing a great job. I would submit, though, that in an undertaking of this magnitude with such consequence, it's important to recognize where there might need to be some adjustments along the way. We are seeing a surge in Michigan, despite the fact that we have some of the strongest policies in place, mask mandates, capacity limits, working from home. We've asked our state for a 2-week pause. So despite all of that, we are seeing a surge because of these variants. And that's precisely why we're really encouraging them to think about surging vaccines into the state of Michigan. And I'm going to continue to fight for the people of Michigan.
And I know, taking up vaccine takes some time, but according to reports in the Post and the AP, Biden officials are telling reporters that you aren't maxing out your orders, that it's a state problem here, that you're not placing them correctly or something, or you're not being efficient in allocation. How do you respond to that?
I don't think there's a governor in the country that's leaving any vaccines on the table. And I can tell you that's certainly the case in Michigan. We are getting shots in arms. We got over 1 million shots in arms just in the last 2 weeks. So we have really been rolling. We've spent a lot of time with the COVID response team walking through. I think we found some common ground at the end of last week around the data. But all of that being said, right now, we know we've got even greater capacity. We could get more vaccines in arms. And when there is a surge, we think that it's important that we rush in to meet where that need is, because what's happening in Michigan today could be what's happening in other states tomorrow. And so it's on all of us to recognize if we can squash where we're seeing hot spots, it's in everyone's best interest.
So did you get any explanation as to why the White House won't surge you vaccine at this time of crisis?
Well, I think they've got a plan and they're committed to sticking to it. And I understand that. And we are definitely grateful for the boots on the ground that they're sending, the mobile units. We're definitely grateful for the therapeutics and the increased testing. Those are all really important. And we're going to continue to work well with this White House. And we're grateful for that. But I am going to also continue fighting for my state. And anyone who's watched what's going on in Michigan over the last year knows that that's how I am. I'm going to fight to get everything I can for the help for the people of Michigan that we need.
So, devil's advocate, if you get doses, are you confident you can actually administer them? Because if you look at what's happening in the city of Detroit, your largest city, the mayor there said, they're really having a hard time in some ways getting the vaccine uptake. There is hesitation. What's the problem?
Well, the mayor's done an incredible job, and I think he has been wanting to expand the population to whom he can offer vaccines. And so we have done that. Michigan was the first to heed the Biden administration's call to drop all of the priority groups and make it accessible for everyone. Right now, if you are 16 and up in Michigan, you can get vaccinated. You're eligible to. But we have thousands of partners who are ready to put shots in arms. We just need those vaccines to come into Michigan.
Would you drop the requirement to make an appointment?
Well, we know that making appointments is really important in terms of our management of how many vaccines we have, in terms of ensuring that, first and second doses, especially for Moderna and Pfizer. And so the appointment process, we think, has been really important. You look at what happened in Florida in the early days where people were waiting in line and it was chaotic and actually somewhat dangerous. We've had an appointment process and it's worked quite well. And I think that with more vaccines, we'll continue to see that work well.
Well, because that's one of the arguments to get it into poorer communities that don't have digital access. What about kids? If Pfizer, which asked the FDA for emergency use authorization to put vaccines in the arms of 12-year-olds, if they get that, would you mandate that for kids to go back to school?
We're not having conversations around mandates. What we are trying to do, though, is to make it easier for people to access vaccines. And I think parents
But why not?
understand.
Schools mandate vaccines for other things with children.
Right. And the schools may well do that. At this juncture, we are not having that conversation. I can tell you this. We have continued to have good mitigation policies. We've continued to move shots in arms. And that's all despite the fact that I've got a reduced set of powers because of the antagonism from my own legislature. And so there's not a conversation on that front, but we are encouraging schools to move forward, to take a pause right now and to promulgate policies to keep their students and their staff safe.
You mentioned antagonism from your own legislature. You've also been the target of some high-level Michigan Republicans. Recently, Ron Weiser, the party chairman, said this about you.
Our job now is to soften up those three witches and make sure that when we have good candidates to run against them, that they are ready for the burning at the stake.
He was talking about you and two of your female Democratic colleagues. The Senate Majority Leader was also bragging that the Senate had, quote, spanked you on the budget and appointments. They've both apologized, but do you think there should be repercussions for misogynistic, threatening remarks like this?
Well, when you say that they've apologized, I don't know to whom they've apologized because I haven't heard from them. I can tell you this, though, that sadly, in this moment, there have been a lot of death threats. We know that there was a plot to kidnap and kill me, death threats against me and my family. It's different in what I'm confronting than what some of my male counterparts are. So, yes, I do think that there is a layer of misogyny here that every woman in leadership has been confronting and dealing with to some extent. I don't have time, though, to focus on that or to go punch for punch. I'm not going to do that. I've got a job to do, and that is helping get my state through this, helping get our economy back on track, supporting the American Jobs Plan so that helps us do both of those things, and that's what I'm going to stay focused on.
Governor Whitmer, thank you for your time. Good luck.
Thank you.
Right back to talk about kids going back to school and keeping them safe. Stay with us. We go now to California State Superintendent of Public Instruction, Tony Thurmond. He joins us from San Francisco. Good morning to you.
Morning, Margaret. Thanks for having me on.
Thank you for joining us. Well, California is the last state in the country in terms of reopening schools, but elementary schools in LA tomorrow are going to be returning to in-person learning. Why did it take this long? Why didn't the governor really force things to reopen?
Well, if you think about the complexities of our state, we have, 6.2 million students. You mentioned our largest school district, Los Angeles Unified, is opening tomorrow with more than 600,000 students. And if you think back to the winter, we had one of the biggest spikes anywhere. I mean, we've lost more than 60,000 Californians. We have 3.7 million cases. This has been complex, and everyone has been trying to find a way to get our schools open. We're pivoting now, and we're at a place now where we see 9,000 of our 10,000 schools are either open or have found a way to get open. So we're moving forward by giving our schools what they need, vaccines and rapid COVID tests and ventilation and resources to get open safely and to stay open safely.
In terms of staying open, as I asked Governor Whitmer, Pfizer has requested FDA approval to give their vaccine to 12-year-olds and up. The CDC director is hopeful kids will return for in-person instruction in the fall. Will they do that in California, and will you mandate the vaccine?
Well, this week, our vaccines will be, now have eligibility for anyone 16 and over. And so we know that will be important as we look to see more increases of schools that open for our high school age students. And so
but it's
we know
not
that
mandated
right now
for them.
Well, our governor hasn't mandated that, but making vaccines available has been a game changer in our state. We've just surpassed providing 22 million vaccine doses in our state, more than 400,000 to our educator workforce. And so these are the keys that allow us to get our schools open and keep them safe. Of course, we need everybody to continue to wear a mask and to social distance, and as we monitor these variants to make sure that we can stay open safely in our schools.
Will you consider it?
Well, my office doesn't have the power to mandate. We have 1,000 school districts in our state.
But you have the power to consider it.
Unfortunately, as I do have the power to recommend using things like vaccines and COVID tests. These are ultimately individual choices that our families are going to have to make about whether or not their children will take the vaccine. As a parent, I certainly would encourage it. As someone who has recently had my vaccine, I've gone on live to do live webinars for people to see that it's safe, that it's pain-free, and that it can make a difference in keeping us safe. And with all these variants that we're seeing coming to the U.S., we know that the vaccines are among one of the most important things that we can do to keep every one of our 40 million Californians safe.
Mm-hmm. I want to ask you about the kids as they come back into instruction. You spoke powerfully about your own personal experience growing up as the child of a single mom who you lost at a very young age. There was a study that was published this week talking about the 40,000 children in this country who have lost a parent to COVID-19. 20% of those kids, according to this JAMA study, are African American. In California, how do you plan to deal with this particular part of the inequity problem?
The first thing we do when our students return is to really check in on their social and emotional well-being, making sure that they have mental health supports. This has been hard on our kids all across the nation. We've seen a high rate of depression, and we know that we have to first and foremost provide social, emotional supports. Second, with all due respect to the hard work of so many educators trying to support our kids, we literally in this country moved into distance learning overnight because we had to keep people safe. And let's face it, education systems weren't built for this. And so with all due respect to those efforts, we know that many of our kids have had unavoidable impacts. So we'll provide them more tutoring, more supports. We've got to make sure that more of our kids have computers. In this nation, we have so many students, including students of color, who've gone without computers and who've gone without access to high-speed internet. In our state, we've worked to provide hundreds of thousands of computing devices, and we've got all of our internet companies to commit to providing internet at low cost to our students. At the same time, I want to say that many of our families are still asking to remain in distance learning. If you look at nationwide across the country, students of color are asking to remain in distance learning. That tells me they still have concerns about safety. And that's why I think it makes sense to go slowly, to be cautious, to get open, to show folks that this can be done, and to use important resources like what we're using in California. We've secured, with the governor and others, 5 million rapid COVID tests that give you results about someone being positive within 15 minutes. That kind of awareness gives you a sense about whether or not it's safe to reopen your school campuses, and we're using them throughout the state of California.
To make up for lost time, do you need to have a summer semester?
We are planning to use our summer school programs to provide more enrichment, but that's not the only way. At the end of the day, we'll assess where every student enters and look for ways to offset any learning gaps that have been exacerbated during the pandemic. That means a lot of tutoring. That means after-school programs. That means specialized training for teachers and educators, and really working closely to engage our families to make sure we're hearing them, we're providing supports to them, and to make sure that our students have access to high-speed internet.
And quickly, given what we're seeing in the Midwest, do you still intend to hold youth sports? Because that's being seen as a way the virus is being transmitted.
Our state has opened for sports. Many of our school districts are using the rapid COVID tests to have awareness for our athletes. What we're planning to do is continue to monitor these new variants and to make sure that we are doing the things that we know that will keep us safe, using face masks and social distancing. We're going to have to continue to do these things for quite some time.
Superintendent, thank you very much for your time this morning. We'll be back in a moment. We want to take a quick look now at the COVID news around the world. CBS News senior foreign correspondent Liz Palmer reports from London.
Good morning. As the global death toll from COVID closes in on 3 million, there are 3 main hotspots on the planet: India, Brazil, and Europe. Even in well-off, well-organized Germany, the ICU wards in some regions are full and the medical system under strain. Europe is currently a patchwork of lockdowns, and there's a race to vaccinate faster than the virus is spreading. But public confidence has been shaken, first by an investigation into the AstraZeneca vaccine's link to rare blood clots, and now another into Johnson & Johnson's. By contrast, Britain's getting ready to reopen. Infection and death rates are sharply down, so pubs and shops can welcome customers back as of tomorrow. Prime Minister Boris Johnson will be among them.
And on Monday the 12th, I will be going to the pub myself and cautiously but irreversibly raising a pint of beer to my lips.
Politicians across India are on the campaign trail. And rallies like this, with few masks and no social distancing, are helping to fuel an explosion of COVID cases. The rise in deaths is so alarming, authorities have decided that India, a huge vaccine producer, will stop exporting any and keep everything it makes for itself. In Brazil, too, the situation is critical. Hospitals are overfull, some running short of supplies. And the number of COVID deaths every day has tripled since January. With vaccine shortages and no strict lockdown, the situation is deteriorating. And that's a global concern because new variants will inevitably emerge from a runaway outbreak like Brazil's. And if they're vaccine resistant, that could put us all back to square one. Margaret?
Liz Palmer, thank you. We turn now to former FDA Commissioner and Pfizer board member, Dr. Scott Gottlieb, who joins us from Westport, Connecticut. Good morning to you, Doctor. The governor of Michigan name-checked you in her press conference this week as one of the health experts she has recently consulted with. So let's start there. What do you think of her request to the White House to surge vaccine supply? A number of health experts, the former Surgeon General, for example, have said this is a mistake on the White House's part not to deliver her the doses she says she needs.
Well, look, it's a request that's been made for weeks now, and I think we should have done it weeks ago. It's never too late to do it. And it's not just additional vaccine, but it's the resources to actually get the vaccine into arms. Some of the federal resources that FEMA has. They're developing these mobile vans to go into communities to ramp up vaccination. I think we need to think about putting those resources into hotspots. It's been sort of a Hunger Games for vaccines among states so far, and we need to think differently about this pandemic. If you look at all the planning for past pandemics, the flu planning that we've done in the past, even planning for bioterrorism incidents, it always contemplated surging resources into hotspots. It never perceived that there was going to be a confluent national epidemic, but there were going to be localized outbreaks. That, in fact, is likely what we're going to see going forward. We're not going to see a confluent epidemic, but we'll see these hotspots. So we need to get in the habit of trying to surge resources into those hotspots to put out those fires of spread. And it's not just Michigan right now, it's the entire Great Lakes region.
Is there a good reason to be sticking to the plan of only delivering doses based on population size?
Yeah, governors are going to complain about it. Every governor wants their allocation, but we're going to be in a situation probably as early as 3 weeks right now, 3 weeks from now, where supply outstrips demand. And I think a lot of states are going to see themselves with excess supply and excess appointments. So it's going to be a shame to look back and in retrospect realize that we probably should have put more vaccine into some of these hotspots to snuff them out earlier. Now it's tough because the vaccine does take time to have its effect. It doesn't have an immediate effect, and that's why we should have done it earlier. It's never too late. But if we start surging supplies into Michigan now, start surging capacity to deliver those supplies into Michigan, it could have an impact on the tail end of the epidemic that they're experiencing. There are some signs that they're rolling over right now, that cases may be starting to come down. They may be reaching a turning point. A lot of their cases are in younger people, people who haven't been eligible for vaccination. If you look at the cases, about 15% increase in cases for those under the age of 18, a 50% increase for people between the age of 20 and 29, a 30% increase for people between the ages of 30 and 39. So they're occurring in groups that haven't been vaccinated.
And the governor and the CDC director both highlighted youth sports activities as a possible vector of transmission. What do parents at home take away from that? Do they send their kids to the classroom but not let them go to lacrosse practice?
Well, what we've seen consistently through this whole pandemic is that the risk in the schools correlates with the risk in the community. So if you're in a community that has relatively low prevalence, and that's a lot of parts of the country right now, things are starting to look better across a lot of parts of the country, the risk in the schools is lower. If you're in a community that has a high prevalence, like the Metro Detroit region, the risk in the schools is higher. And in fact, a lot of the outbreaks that they're seeing are associated with the schools. There's been a 17% increase in outbreaks in the community associated with spread that they think originated in schools in the first week of April, if you look at the Michigan data. So I think it was prudent that the governor tapped the brakes, or at least made recommendations to local authorities to tap the brakes on extracurricular activities and also high schools. They're going to need to take a pause until they get over this surge of infection that they're seeing right now. But in most parts of the country, I think that you can open schools safely. You can continue those activities safely in lower prevalence environments.
Both the governor and the California school superintendent were reluctant to embrace the idea of a mandate for a COVID vaccine for kids. Why? You have to be vaccinated to go to school in most states. Why should COVID be any different?
Look, people have come to accept the other vaccines in the pediatric schedule that you referenced, measles, mumps, rubella, flu vaccines. I think this is novel. I think issues around COVID have become an unfortunate political flashpoint in this country. And I think you're going to see governors across the political spectrum be reluctant to mandate it, in part because they know if they step into this debate and impose mandates, that's going to engender more opposition. So they're likely to leave it up to local districts, at least to start the year. I think what's going to happen is if you see outbreaks in local communities, there'll be pressure for local school boards to mandate the vaccine. And I think you're also, unfortunately, in some communities, probably going to see fights among parents trying to influence local school boards to mandate vaccination, or local health districts to mandate vaccination among kids. So this is going to play out at a local level. Hopefully we enter into the school year where enough adults are vaccinated that we don't see outbreaks in the schools. Again, the community spread is the best predictor of what happens in the schools. And if you look at the data out of Israel, you're seeing cases come down substantially among kids below the age of 16, not because they're vaccinated, but because their parents are vaccinated, so they're not bringing the infection into the schools.
What do you think of this idea of vaccine passports?
I think we should allow people to own the information about whether or not they've been vaccinated. Right now, you don't own that information. The card that you got can be bought on eBay. It's not going to be verification. We've piggybacked reporting on whether or not you've been vaccinated on the child immunization scheme. There's 64 districts that the states report to on who's been vaccinated for COVID. That system is actually the system that states report to on childhood immunization. It can't be queried by individuals.
Yeah.
You can't get access to that information. So we need to create a way for people to own this.
I've got to cut you off there. Dr. Gottlieb, thank you very much. We'll be right back. For Face the Nation, I'm Margaret Brennan.